Nowadays, we are generally seeing that everybody wants to look their best and have to have a flawless skin. Whether we see men, whether we see women, children, teenagers, everybody is having a race behind having a best look of their own and to look awesome. And why not? Everybody has a right to look best in their own possible way, as everyone is beautiful. Don't you think it will be a great thing if cosmetology get incorporated in your career? Yes, it is possible. You heard me right. Hello, assalamu alaikum everyone. My name is Dr. Nida Sheikh from Dento Magic. If you're new here, then welcome. If you've already been a Dento Magic family, then welcome back. So in today's video, we will be talking about a new career, that is facial cosmetology after BDS. How you can incorporate facial cosmetology in your career and get a successful career. After this, you will be the one who will be giving the people their best look. Before diving into the video, if you are interested in such videos, then don't forget to hit the subscribe button and be the Dento Magic family. Now getting on to the video very quickly, but before that I have a little disclaimer for you guys. So the facial cosmetology can be practiced by the dentist on their private clinics, as the dentists are not called for consultation of facial cosmetology. So I will be telling you how you can be incorporating this field in your dentistry and be successful. So are you guys ready? Are you guys excited? Let's dig in. Stay tuned till the end if you guys want to know the full details, the scope, how you can incorporate this field in your practice and be successful by including this field in your clinic and in your daily practice. You guys tell me, what is the first thing that comes to your mind when you hear the word cosmetology? Any guesses? You might have guessed. Yes, we all think of lasers and therapies and PRs and threads and lifting and everything. But cosmetology is not limited to this. So let me tell you the first thing, that is, what is cosmetology? So cosmetology is the study and the application of the procedure to enhance your beauty, as we all are aware of. And enhancing beauty could be anything. It could be normal skincare, it could be hairstyling, it could be manicure, it could be pedicure, your facials, and the most important thing that the dentists are doing since ages, that it is giving you the best smiles, giving you the perfect teeth, which comes under our section, and we are certified to enhance your beauty in this aspect of area. So don't you think you got the new definition for cosmetology as related to dentist? And now the cosmetologist is a trained person that is designated to do these procedure and use it. Now here I want to add a small thing, that is, cosmetologist is not a term that is designated only for the medical field. It is not designated to the certain criteria that only these people can do it. So I will elaborate this thing a little bit later on the video, so stay tuned. And coming on to the next thing. Now many of you might get confused that what is the difference between the aesthetic and cosmetic dentistry and facial cosmetology. So let me clear this in a small gist for you guys. So the aesthetic and the cosmetic dentistry has been introduced in dentistry since decades ago. It has been mainly focusing on the teeth, gingiva, intraoral aspect, and the main oral cavity involving it. And now coming to the facial cosmetology, it mainly focuses and enhances the beauty of the nose, face, cheeks, chin. I hope now your confusion is now resolved and you understand the difference between both. Now the thing is, you might be thinking how this facial cosmetology can be incorporated in your dentistry. Our dentist going to perform the same procedures as the beauticians perform it, as they are also trained on a certain level of doing this procedures like manicure, pedicure, facials and other thing, as it is a part of cosmetology. So the answer is no, you are above all that, because you are dentist and you are trained and you have studied so hard, studying about the anatomy of your hair and neck and the face, and you are the best person to know about the deformities and impairments of the face muscles and the nerves incorporated in it, and the faceliftment, upliftment and the orthodontics are doing this since ages, as they are aligning the teeth, they are removing the bone deformity, oral surgeons are going for it. So dentists have been in this field since year, but we didn't had that broad spectrum to see it in that way, that it can incorporate it in the facial cosmetology. So we'll be talking about all about it. So here is a small disclaimer for you guys, as there has been a long debate whether the dentist can perform the advanced facial cosmetology procedure or not. But here I want to add a little thing and a little disclaimer that you can practice facial cosmetology in your own boundaries of being a dentist. Yes, you can, and nobody can stop you, as you are a dentist and you are an expert about the muscles and the face and the neck and the teeth and the intraoral and extraoral cavity. So you don't have to worry about it. Now coming to the best part of this video, that is what a facial cosmetologist do and what a dentist can do. To be honest, including this topic of what procedures can a facial cosmetologist do and perform is a vast topic. So let me give you a quick synopsis about what are the things that facial cosmetologists do. So the first thing is facial chemical peeling, microdermabrasion and microneedling, and it also incorporates the procedures like thread lifting, derma filler, PRP, and here the role comes the rhinoplasty, which is mainly performed by the oral surgeons, which is a part and a department of dentistry. The surgeries of the nose, and if the accident happens and there is an injury in the jaw or the jaw replacement, it is being done by the oral surgeons. So dentistry has been living this and performing this cosmetologist procedures since ages. Hair transplantation, which comes under trichology, and the jaw replacement and the surgeries like BSSO is done by the oral surgeons. Botulism injections, that is known as Botox in the layman language, is also involved in this cosmetology procedures. The basic cosmetology procedures like facials, manicure, pedicure can be done by anyone. It doesn't need any medical background. As it is performed by many of the beauticians, almost all the beauticians in their beauty clinics. But coming to the advanced procedures like Botox, thread lifts, it needs an increased clinical skills and the knowledge of the anatomy of the face, as it can completely damage your face if it goes wrong. As we all are dentists, and we are bounded by a very big myth that we are just bound to the teeth. We are just responsible for the teeth, but I want to break this myth right now and bust this myth right now for everyone, as we have given our 4 years in this field of dentistry and we have studied everything about the face, about the head and neck, and we are the best people to know about it, to know about the deformities, impairments and everything in detail. And it's not about the people out there who think that we are just bounded to teeth and we can just extract the teeth and we can just put up the teeth, but it is us also, that we are just stuck up in the thinking and end up being thinking that we are just only and specialist for the teeth. But remind you guys, we have studied all these 4 years and we know the best about head and neck. So let me brief you guys how you can enhance one's beauty by just being an expert in your own field. So talking about the first thing, that is the filler. If you guys are aware that fillers are just the hyaluronic acid, and it is just another name that we have been studying in our dentistry. If you guys are not aware that we have studied it by other name, that is hydroxyapatite. And I know many of you have guessed that how we have used hydroxyapatite. Yes, we have been using hydroxyapatite in the sinus lifting, in doing graft, in removing cyst. So we are using fillers in another way in our own way of technique, being in our own boundaries. The other fillers that we have studied in our courses is polylactic, and the other is biorevitalization. So these are just the terms that we are familiar with. We are not familiar with the fillers or the layman language that people have been using out in the facial cosmetology. So you just have to see it in the right way to use it and to enhance the beauty. Now coming to the next thing, that is Botox, which which is a company name which has been used worldwide now. I don't know about worldwide, but yes, usually in India, and in our terms of dentistry it is known as neuromodulators. So let me tell you how neuromodulators work. Neuromodulators are the modulators that enhance and are used in such a way so that your muscles stay healthy and stay in harmony. So the work of the neuromodulator is to keep your muscles and your joints healthy and in harmony. So the other word for the Botox is neuromodulator in our terms, which we have studied in our course, and it is used in such way. As we all know, if the muscles and joints are not in harmony and not functioning properly, and if there is any impairment, your face anatomy is changed right away. Don't you think that? So for that, you don't have to go to the dermatologist, you have to come to the dentist, as we are the expert. And next is the threads, that is the regenerative and make new collagens. So now you know how you can incorporate the facial cosmetology in your dentistry, and being in your own field of expertise, you are not breaking any rules. Even if a debate get exceeded and you know it, then also you can go for it. So let me give you a small example. Like a patient walks in and he wants a prosthesis. Along with the prosthesis, when you diagnose it, you see there is a TMJ impairment. So what will you do? You will send the patient to the dermatologist or any other doctor? No, right? You will deal with all the imbalances of the patients. You will cope up and you will incorporate here the facial cosmetology, and you will also give the patient prosthesis, because you are the one who has a better understanding of it. You have studied the muscles of masseter, muscle of mastication, you have the understanding of TMJ, so it's you who will deal with it. So let me give you a small another example, that is a patient walks into you and you have to do implants on that patient, and you notice that that patient is suffering from prognathism or retrognathism, which is known as the extended maxilla or retruded mandible. So in order to enhance the chin, instead of going to the surgical option, you have a non-surgical option, that is you can give the filler in that area and you can enhance the chin. So the injectable fillers will be the solution. It will not completely resolve that problem, it will look better, and after that you can go on with your treatment of implants. Comment down below if you want any specific video on any certain topic, and I will come up with a video for you guys. But people doing facial cosmetology and being trained under the dermatologist or any other trained person thinks that they can practice hair transplantation, but telling you one thing, that is not having enough knowledge about the scalp, stages of hair and everything. I think that is out of the scope of dentistry, don't you think? If you guys agree with me, then don't forget to give a pink heart in my comment box, and I would love to see multiples and millions of pink heart in my comment box. Now coming to the scope of facial cosmetology. So what do you think the scope of facial cosmetology is when you are incorporating it in your dentistry? So the scope also broadened. We think that once we have graduated and completed our studies are over. But the scope get broadening and broadening if you have a capability and ability and want to explore and learn more new things to get incorporated in your field. So it's up to you whether you want it to be limited in that what you have studied and doesn't want to grow to that level. If you want to grow and have a broader spectrum of scope, then you have to learn and you have to explore and you have to see how you can give a new way to your own practice. The best thing is to understand things, rationalize the things step by step and one thing at a time, and I promise you that you will be successful. Coming to the very important aspect, that is how you can attract or tell your patient that you offer all these procedure and you can help them in the best way possible. So the answer is social media. Yes, to these days social media is the best answer to all of this. So what you can do is you can post the photographs of before and after the treatment, so that it will help the people know what it was before and now what you have done to them and what best results you provide them, right? And we have been doing this while we were in our graduation. We used to take photographs and we used to keep the IOPR and keep the record of everything. So it is not new to you. You just have to post it on your social medias. The second thing is mouth to mouth. That is spreading word from one patient to other, and if one patient is satisfied and happy with the result of the treatment that you have done, will bring another 2 patient, and that 2 patient get happy, they'll bring another 3. So this is the pattern how you will be advertised by the people without even asking them to do it. And you guys won't believe, once you start doing it and incorporating facial cosmetology in your practice, you won't believe that you have been doing all this since starting and you just have noticed right now. When you will start practicing facial cosmetology in your daily practice, then trust me, you will be seeing the patient in that certain way. You'll not only seeing the teeth, but you will seeing the patient muscles and the face and how you can uplift it. I am not sure, but if this happens to you guys also, then let me know in the comment box and I'll see how many people have been doing this. So what happens is when I started studying about teeth, when I joined dentistry, then I started observing people's teeth. I don't know, it was unintentional. I didn't mean to do that. But whenever I used to speak to a new person, I always observe their teeth. Sometimes people get so awkward and move away from me. But I don't know how it made. I can relate now why people become awkward, because sometimes their teeth are not that good that people see and get attracted to them. So yes, it was my habit. Until now I'm doing it. I'm trying to just get rid of this habit and not making people awkward. So once you incorporate facial cosmetology in your field, I think you will see the patient and the people in that aspect, and you will be able to relate things with the people and what you can do best for them and what other treatments you can do for them. So these are the things that I thought you must know, and comment down below if you also had the same habit that I do, and I would love to see the people telling their stories. So here is a small thing to tell you, a small disclaimer, that is dermatologists are the only one who are approved by the council. Otherwise the cosmetologists and trichologists are only the person who are trained in certain things and are practicing in their own private entity. Hope you guys have enjoyed today's video, and I hope you are having your own stories. So please comment down below, and I would love to read all your comments. So that's it for the video. I hope you liked the video, and if you did, then don't forget to share it with your friends. And if you like the video, then don't forget to hit the like button, subscribe my channel, and be the Dento Magic family. Stay tuned till the next video. Till then, stay safe, be happy. Allah Hafiz.